Hello everybody, my name's Nadia Maalin, I'm a PhD student and today I'm going to be talking to you about a body size perception intervention for women with heightened body concerns. I'm first going to discuss body image and why it's important to research and to develop interventions for body image, the aims, methods, materials and procedure of this particular study, discuss some preliminary findings and applications of the intervention in virtual reality. I will then conclude and discuss future work and the impact of this current intervention. So what is body image and why is it important to research? So body image is a person's mental representation of their own body. So this can be body size, shape and appearance, and it's the thoughts, feelings and perceptions about the body. So it's usually thought of being comprised of two distinct yet interrelated components. One of those components is the perceptual component. So this is the kind of mental picture, the kind of image of the person's body size, shape and appearance. Whereas the attitudinal or the cognitive affective component is more about those thoughts and feelings about the body. So body image is super important because it can have a large influence on a person's day-to-day life. So whether that's emotional well-being or mental health or just how a person interacts in their day-to-day life. So it's really important to research body image and develop interventions that specifically target a person's thoughts, feelings and perceptions about their body. Body image is also relevant in clinical settings, as we know, for eating disorders. So body image disturbances are often considered a core feature of some eating disorders. So for example, the diagnostic criteria for anorexia includes a disturbance in the way in which one's body weight and shape is experienced. Also, empirical research has found body image disturbances in people with anorexia, so it shows some kind of discrepancy between the way they think they look and how they actually look. So this is one type of disturbance in terms of not being able to accurately estimate their own body size and shape. And research also indicates that there's an idealization of a thin or a low body weight. There are often difficulties in the treatment of anorexia and relapse being a significant problem. So some research has indicated that perhaps specifically targeting body image might be beneficial and might be promising and effective, included with existing therapeutic techniques and treatments. However, there's much more research to be done in this area, much more trials of body image specific interventions and techniques. So today I'm going to talk to you about the development of a computerized body size perception intervention, which uses a cognitive bias modification technique, which is based on modifying a perceptual boundary. And modifying this perceptual boundary in some cases has been shown to also have positive cognitive affective outcomes. So this particular intervention that I'm going to discuss today was developed from an emotion recognition cognitive bias modification intervention. For this intervention, the perceptual boundary was based on emotion recognition, so happy or angry, and the modification of this boundary, where ambiguous expressions were challenged, resulted in improvements in psychological outcomes. So just taking a look at this example, participants rated the faces as either happy or angry. So these two faces were considered happy and the rest were considered angry. And after the modification of this boundary using feedback, you can see that more of the faces were considered angry. So this kind of ambiguous one in the middle was no longer considered angry and was considered happy post-intervention. So it's this modification of ambiguous stimuli modified towards a more positive or favourable outcome. So some research has indicated that bodies can be categorised by size. So some bodies are considered thin 100% of the time using a female sample, and some body sizes were considered fat 100% of the time using the same female sample. And then you've got the body sizes in the middle that are a bit ambiguous. The aim of the intervention then, drawing on this technique, was to understand whether categorisations of ambiguous body sizes could be altered, and if so, were there then positive psychological outcomes in terms of body image, disordered eating behaviours, self-esteem, etc. So previous examples using this intervention have found positive outcomes in women with high body concerns and women diagnosed with anorexia nervosa. So they were able to successfully shift the perception of body size towards a more favourable outcome in that less bodies were perceived as fat after the intervention. So again, just taking a look at this figure to give an example. If at the beginning of the intervention these bodies was considered thin and the rest of the bodies were considered fat, after the intervention more bodies were considered thin and less bodies were considered fat. So the perception of a fat body was pushed higher up in the BMI or the body mass index spectrum, so that it was a higher body weight that was then considered fat post-intervention. And this was associated with improvements in psychological outcomes after the intervention. So there were improvements in disordered eating scores and body image concerns measured using questionnaires, and this was maintained at a 2-week follow-up. Another study using a similar technique but different images also found that they could shift the perception of what is a thin and a fat body size higher up in the BMI spectrum so that less bodies were perceived as fat. And they also found improvements in psychological measures at the follow-up. So there are decreases in the drive for thinness and bulimic symptomology, and again maintained these perceptual and attitudinal outcomes at the 2-week follow-up. So these provide promising findings to indicate that we can shift the perception of what is a thin and fat body size, and that doing so may also have a positive influence on the person's own psychological well-being in terms of body image and eating disorder symptomology. So the aim of the study for my research was to investigate the replicability then of this intervention. If we're thinking about the clinical utility and effectiveness of an intervention, we want to make sure that these findings are reproducible. And I also wanted to develop understanding about the longer lasting effects of this intervention. So the previous studies that I've just mentioned did a 2-week follow-up and found that the outcomes were maintained. So I also wanted to extend the follow-up dates so that we could see whether the effects lasted for even longer than 2 weeks. If we're thinking about the clinical utility and effectiveness of an intervention, we want to make sure that the effects are longer lasting. So for this study, as in the previous examples, we employed the body size perception task. So this was determining a person's thin-fat categorical boundary and using a cognitive bias modification technique to alter that boundary in the intervention group. I also measured their psychological outcomes using a variety of different self-reports. For the sake of time for this presentation, I'm going to focus on the EDIC. So this is a measure of eating disorder symptomology, weight and shape concerns. So this is how the body size perception task would look. So we'd first determine their thin-fat categorical boundary. So this is their baseline responses. Next would be the training element. So this is the cognitive bias modification element, where we use written feedback to either shift their boundary using inflationary feedback, so that is in the intervention group. We also had a control group which also received feedback on their responses, but they received feedback which reinforced their baseline responses. It wasn't trying to challenge or modify the existing categorizations of the body size. It was consistent with what they responded here, so we weren't trying to shift their perceptions in this case. And then lastly, after the modification, they completed this same task again. So we could calculate whether there were any changes following receiving feedback which either tried to shift their perceptions or maintain their perceptions. So this is an example of how a trial might look. So they would receive a fixation point followed by the body on the screen for 150 milliseconds. This was followed by a short mask of visual noise and then a question mark where the participants gave their response. So it was a forced choice or categorical response, so they did have to say the body was either thin or fat. There was no kind of in between. and they would do that multiple times for all of the body sizes. In the training phase, they would get feedback after their response, which either challenged their response, and when they categorised it as fat, it will tell them incorrect, that body is thin. Or in the control group, it would maintain their responses, so they still get some feedback, but it wouldn't try to challenge or change their responses at all. This is the range of bodies that were shown to participants, and they range from underweight to obese. So there were 4 days of training for each participant. So they completed the body size perception task on 4 consecutive days, and we measured their psychological self-reports at baseline, so before they did any body size perception tasks, and then immediately after their final training session, so we could see if there are any changes in psychological outcomes. We then employed 2 follow-up sessions in this case. So the previous research employed the 2-week follow-up, but we also employed a follow-up on day 30. And we measured their perceptions of thin and fat body sizes. So this was just the baseline responses and their psychological outcomes using the self-reports. I had 38 participants, which were all identifying as female. They were 18 to 48 years old. To identify those with high body concerns, we employed a pre-screening questionnaire, which was the body shape questionnaire, the 16-item version, and those participants scoring 60 and above were identified as having kind of heightened or higher body concerns. So they were invited to take part as long as they had no history or current diagnosis of an eating disorder. So I had 19 participants in each condition. So intervention group where their perceptual boundaries were modified, and 19 in a control group, and they are both very similar in age and body mass index. I'm going to quickly go through some preliminary findings of the perceptual outcomes and also psychological outcomes using the EDIC global scores. So let's start off with the perceptual boundary, where we looked at whether there is effective condition on the categorical boundaries, whether there's effective day, and also this consideration of their baseline scores before the modification task, and then their post-training scores, so after receiving the feedback. So this is what the results look like. I'll go into more detail on the next slide, but what we can see here is that there were increases in the categorical boundary across the duration of the study, and what this means was that the perception of thin was shifted higher up in the BMI spectrum, such that less bodies were considered fat. The blue and purple lines are the intervention group, suggesting that they have a slightly higher categorical boundary, and the orange and green lines are the control group, again suggesting that there was a bit of an increase in their categorical boundary, but it was lower than the intervention group. So when we look at the post-hoc comparisons of this model, so when we look at the differences in the baseline boundaries, so this was the perceptions of thinness before any feedback, and this was measured on each day of the study, we find that there were significant differences between the intervention and the control groups on days 4, on days 15, and also on days 30. So this means that in the intervention group who received feedback which challenged their perceptions of thin and fat had a higher categorical boundary, which means that they considered less bodies as fat and their perceptions of thin was higher up in the BMI spectrum than those in the control group. Secondly, there were significant differences in the post-training boundary between the groups on day 4. So the post-training boundary is blue line. So if we look at day 4, so after the 4 days of training, again, the intervention group had a significantly higher categorical boundary than the control group, which indicates that the feedback actually did produce a shift in the intervention group compared to the control group. And then we see that there were significant changes in the boundary. So when we consider the baseline, so before any feedback, and their post-training, which is after the feedback, we see that on day 1 for the intervention group, there was this big shift in their perceptions, whereas the control group who received feedback which were consistent with their baseline responses, they didn't see any shift in their post-training categorical boundary, which is what we would expect given that the feedback in the control group aimed to maintain their responses, whereas in the intervention group, the aim was to shift their responses. This is what we see in our findings. And we found that there were significant increases in categorical boundary if we compare days 15 and 30 compared to day 1 for both groups. We do see that the perceptions of thin has increased in BMI for both groups, although we do see that there is a sharper increase for the intervention group specifically. So I did a linear mixed effect model as well for the psychological outcome, considering the intervention versus the control group, and also the days that we collected the psychological outcomes were the first day, post-training on the 4th day, and at the follow-ups. So my findings don't indicate that there were any significant effects on psychological outcomes. So we do see that scores are lower on day 4 compared to the first day, but this follows the same pattern for both groups. And these results were not significantly different, which indicates that in this trial in particular, changing the categorical boundary in the intervention group didn't have a significant effect on the psychological outcomes. So I did mention previously that this trial has been employed in virtual reality. So this is where the bodies can be displayed life-size and 3D, and you're in this immersive environment where you can't see anything around you. You're just in a room with the body, and it follows the same technique that I've just discussed, using a 2-week follow-up only. And here again, similar findings, positive outcomes in women with high body concerns in terms of a shift in this categorical boundary, so a shift in these perceptions of what is a thin and fat body size, and also clinically meaningful reductions in the EDIC. So after the intervention, those in the intervention group had scores within community norms on each of the subscales, and this was maintained at the 2-week follow-up. So this means that we're seeing clinically meaningful results when using the intervention in VR. The findings are actually more substantial than the original 2D version, which I discussed at the start, and more substantial than what I found in my trial, which indicates that perhaps a virtual reality method might be more effective than a computerized version on the screen, although this is an area for future work. So overall, this is a novel technology-based body size perception intervention, which can be computerized or used in virtual reality. And it's the type of body image specific intervention which can be used alongside existing tools and therapies. So not exactly aimed to be used as a standalone technique, but something that can be employed alongside existing tools and techniques. And it means that we can incorporate the use of 3D bodies and virtual reality technology into psychological treatments, which is an increasing area of research. So future work does need to be done, and future investigation of the utility and effectiveness of this intervention. So a few trials have found promising findings, such as changes in perceptions of body size and positive psychological outcomes. So we really need to do future work on the effectiveness and whether the effectiveness is increased in virtual reality, as that one study does suggest. We might also want to think about optimization then, so what modifications can we make to this intervention to make it more effective? So we've got a virtual reality component, but also what about the training protocol? Is 4 days enough? And what about the timings of the stimuli presentation? So there's lots of things we can think about modifying to make the intervention more effective. So we should also think about developing our understanding about the mechanism behind this intervention in terms of changing perceptions and how that might have a positive psychological outcome. In my trial, I didn't find the positive psychological outcomes, so we need to further investigate why that was the case in this particular trial. So I'm really looking now at these kind of relationships between the categorical perceptions of body size and how this is related to psychological well-being, body image concerns, disordered eating, symptomology, etc. So thank you for listening. That is my presentation. I hope you enjoyed. I'm looking forward to answering any questions you do have, either in the live chat function, or you can contact me via Twitter, email, or ResearchGate. So and look forward to hearing from you. Thank you very much.